Thank you so much for this opportunity. My name is Maxine Holman. I'm the CEO of Flying for Life in South Africa. And Flying for Life was started as an initiative in South Africa to help rural communities with different issues, specifically access to healthcare in rural communities. So that is our drive, is to get into isolated communities and help them from a just even like grassroots base of healthcare, even education, and yeah, that's kind of what Flying for Life does. We were invited to the Africa Health Conference last year, so it was the first time we had interacted with Africa Health. But I think there is a great connection between us because we're in Africa, for one, and also we focus a lot on health and just the basic healthcare needs of people living in South Africa specifically. So I think that connection is important, and then collaboration for us is a big thing. So we collaborate with many different organizations, and it made sense for us to collaborate with Africa Health because it's healthcare and it's Africa. And I think we have the same vision and the same inspirations and aspirations and goals. So it just made sense, and it felt so right to collaborate with Africa Health. Because when you collaborate, you have a greater impact. It's better than doing it yourself. True. And also your network of people and your network of individuals, your network of resources is helpful to us as an NGO. And then also you also have a platform for people to connect with you, to get involved with NGOs and what NGOs are doing. It's a great network. I didn't personally go, but the feedback I got was amazing. Like, there was so many interactions with different people, even with there's a midwifery organization in South Africa that we connected with because of Africa Health. There are a number of connections and people that we already knew, but we got to know them on a deeper level because of Africa Health. So I think the interaction was very positive. There was a lot that came out of what happened last year. And then we also, I think we attended the dinner this year, which is again another way of connecting and kind of solidifying a partnership and a way of working together with you. It's an issue across the board with NGOs, is fundraising and funding for what we're doing. And a lot of times people give money to us, but they restrict it to specific projects. And I think that's one of the biggest challenges, because as an NGO, we also need to cover our overheads. We have people that we need to pay, and so that's one of the challenges. If we don't have like general funding, then it's difficult to do the projects. It's difficult to do the restricted projects. So that's a challenge. And then also with our work specifically, to get volunteers and people, medical professionals, that are able to go out to the rural communities. We've got a great eye doctor project, but there's other specialities that are needed in these rural communities that we sometimes struggle to find. So those are probably two of the biggest challenges that we have when it comes to the work that we're doing in South Africa. We're currently working in the Limpopo province. We do a lot of work in the Limpopo province. We've started working in the Northern Cape. And then also looking to explore areas in the Northern Cape and the Eastern Cape. But specifically, it's been Limpopo and the Northern Cape, and the next area would be KZN and then the Eastern Cape. Wonderful. So very rural. So it's very difficult to get. It's very difficult to get to them, especially for medical professionals. They don't want to give up 3 days. If they can be flown in, do what they need to do, and be flown out the exact same day. There's more impact for them because their time is precious, I suppose. So I think one of the stories that resonates with me is, we're a flying NGO and we collaborate with individuals, and we took an NGO out into a rural community, and they were able to do childhood cancer awareness with the rural clinics, and there was. We had gone out to a very rural village, and there was a sister in the clinic that had told us about a child that had growth on their eye, and they thought maybe it could be cancerous. So we were able to connect with our eye doctors. We were able to take photos of the child and connect with our eye doctors, and they were able to operate. So it's like because of the different collaborations that we have, we were able to help this one child that had a growth on their eye. It didn't turn out to be cancerous, but the eye doctors were able to do surgery on her eye and remove the growth. Otherwise that would have hampered her eyesight in the future. So it's stories like that are inspiring. And also when our partners detect early childhood cancer in those rural communities, they're able to refer them and get that sorted out before it goes too far. So without us flying them there and connecting them to those communities, you might find that children are dying without being diagnosed, or so we're trying to prevent that. And so when we partner with the likes of CHOC and the other organizations that we work with, it's inspiring, and it inspires us to continue doing our work. Even with our eye surgeries, when we fly to these rural communities and you're restoring people's eyesight in 30 minutes. In 30 minutes they have eye surgery, if not less, and then the next day they can see. For me, that's inspiring. If you do 15 patients in a day, that the next day, these people have their eyesight back. And especially if they've been on a waiting list for so long, for so many years, they're on a long waiting list, waiting for their eyesight to be restored. And it's such a simple surgery. And that for me is inspiring. If we can just help one or two people, and that impacts their family and that impacts their community, I think it's powerful. There's still definitely a lot that needs to be done, especially in communities that are rural, that are isolated. They're not in the urban areas. The urban areas understand and they have a bit more access, but it's those communities that are more rural that still need to be reached, and they still need to understand. I mean, cancer awareness is such a big thing also in these African communities, because they might not understand cancer and the different cancers. They might not be able to detect, to know that, this is actually cancer. They might misdiagnose it. So it's important to create that awareness. And it's not just childhood cancer, it's anything, even diabetes. If diabetes goes unchecked, or if people don't understand it, then how do they look after themselves? So it's even simple things like that. Yeah. Well, one of the biggest issues is the lack of specialists, I think. And so especially like with the eye doctor surgeries, I know in the Northern Cape, there's maybe one, or there's a doctor in an area, an eye doctor in an area, but there's so many different facilities, and so they have waiting lists of people needing surgeries on their eyes, even just cataract surgeries. So because we have a lack of specialists, then we have a waiting list for cataract surgeries, and if you have one ophthalmologist in the region, they can't keep up with that need. Yes. There's all sorts of needs, I think, also because there is I suppose you could call it brain drain in South Africa. A lot of the specialists are leaving the country, and so then you're left with people that still need to learn. They are going to universities that still need to become ophthalmologists, and then you have a bit of a gap because there's people that have left, and there's still only people that are coming up into the health profession, and then you've left with a gap, and then the needs just grow. Yes, for sure. I mean, we will have a stand there this year. So people can come visit our stand and hear more about the volunteering options that we have, about flying into those rural communities and helping. We're even working with a palliative care, children's care home, and they need specialists. Even Northern Cape, they've given us a list of specialities that they need, medical specialities that they need. So, I mean, if people come visit us and they tell us, I'm a radiologist and I want to give of my time, then we'll put them on our database and know that, okay, we can go to this person and we can say, we're going on an outreach and we need you to come and join us. So from that perspective, volunteering people's skill sets would be amazing. And there's also, from a funding point of view, even just materials. I know that the ophthalmologists need a lot of materials and resources, medical resources to do the surgeries. Even machinery like the phaco machines and the eye testing machines. Sometimes those machines don't always work in the areas that we are in. So there's maybe needs for that sort of kind of donation. And even funding. I mean, if there's funding that people need to give away, then Flying for Life is definitely of need of funding from a restricted point of view. So if it's for a specific project, or if it's just general funding, that would be very helpful for Flying for Life and to continue the work that we're doing. It's going to be amazing to meet everybody, and it's awesome to work together and to collaborate to make a difference in Africa. I think there is a big need for healthcare and even just awareness and knowledge and sharing of knowledge and sharing of skills. And so if we can all come together and make a difference, that would be amazing.
Definitely.
Because health is important, and if we can help one another, then I think that'll go a long way. And thank you so much for the opportunity of partnering with Africa Health. It's an amazing opportunity, and we are so grateful for it. So thank you.